Hi everybody. So in this section we're going to talk about what exactly is a psychiatrist. And again, I know this is something that seems obvious to those of us who are psychiatrists, but it's not always so obvious to others. So let's break it down and go through exactly what we do to become a psychiatrist. So we, first of all, we go through undergraduate college, and we don't have to major in medicine. We can major in anything we want, right? You could have a degree in literature or philosophy. It doesn't have to be in science. However, in undergraduate, you do have to take the prerequisite courses for medical school. And those are things like biology, chemistry, physics, and organic chemistry. Then after we take those classes, there's a big exam called the MCAT exam, and that's what helps you when you're applying to school. So after the 4 years of college, if you're accepted to medical school, you go through and complete medical school the same way as any other kind of doctor. So that's 4 years, and most places break it down. For the first 2 years, you're mostly doing book work and lab work, and then the last 2 years, you're mostly doing clinical work. But this can vary a little bit depending on the school. So again, you do the 4 years of undergraduate, and then you do the 4 years of medical school. So at this point, when you finish medical school, you have to take some more big exams, of course, and then you get the degree of MD. Now, if you have an MD, that doesn't necessarily mean you're quite ready to practice medicine yet. So for that next step, we go into something called a residency program. In the residency program, for psychiatry, it's a total of 4 years, and the first year is called the internship year. And that first year, we share with all other types of doctors, and we do basic medicine clinical work. So we do, emergency room, internal medicine, we do some neurology, we do a little bit of psychiatry, but we really do the same rotations as other doctors. And after that internship, if you pass another exam, that's when you're able to actually say that you practice medicine. But we don't stop at the intern year. We go ahead and finish out the 3 more years of residency. We do a lot of training in things like neurology, inpatient psychiatry, that's in the hospital, outpatient psychiatry, and depending on where you do your residency, you do a lot of work with psychotherapy. And this is where I think it gets a little confusing. Psychiatrists do train in psychotherapy. Depending on the residency, sometimes that training can be quite intense. And actually, where I trained up in New York City, psychotherapy was a big part of what we did. So I had a lot of psychotherapy cases. I had specific instructors just for psychotherapy. It was really kind of a big deal. So 4 years of undergraduate, 4 years of medical school, 4 years of residency. And for most of us, that's where we stop, and then we go into practice of psychiatry. However, some psychiatrists get even more specialized training and do something called a fellowship. And a fellowship is normally about a year long, and it could be a child psychiatry, it could be addiction psychiatry, it could be geriatric psychiatry, and there's some other ones as well. So some people have that specialty where they've done even more work. So that's the training that we have. You can hear it's a lot of years, but when we're done, we're able to prescribe medicine, we're able to do psychotherapy, and we're able to do other things too. So some psychiatrists, in addition to working in a hospital or in a clinic or a practice, they do procedural psychiatry. And those are things like electroconvulsive therapy. Those are things like transcranial magnetic stimulation. There's some infusions with ketamine. Psychiatrists can also be involved in legal work. They can do forensic psychiatry. They can be working in health systems as administrators or helping health systems do the best they can to take care of patients. So there's a lot of different jobs that a psychiatrist can have. So I hope this has been helpful and clarified a little bit. In the resource section, I'm also going to share with you a document that compares a psychiatrist to other sorts of medical professions in psychiatry. So I hope this was helpful. Thanks.